Hi everyone, welcome to our webinar this afternoon, Behind Closed Doors, Domestic Abuse During the COVID-19 Pandemic. I'm Yvonne Liu and I work as a Communications Manager at Peabody and also co-chair our Gender Network, which is one of our 4 employee networks that are working to make Peabody more diverse and inclusive. I'd particularly like to welcome those of you dialing in from other housing associations, including Metropolitan Thames Valley, Hyde, Southern Housing Group, Optivo and L&Q. And we're also joined by quite a few of our partners in the sector, including Crisis, Shelter and others. A big welcome to everyone. And also a really big thanks to our events manager, Nikki, as well, for making everything happen behind the scenes. It really wouldn't happen without their support. So today's webinar is actually part of a series of events that Peabody are hosting to mark International Women's Day, which was on Monday this week. And we know that the gendered impacts of the pandemic have been really stark. And particularly for people living with domestic abuse, lockdowns have really isolated them from sources of support. And knowing this, what have we actually learned from these experiences, particularly as a housing provider, and how can we further provide better support for victims and survivors? So the format today is I'm joined by my colleague, Natalie Blagrove, who is our domestic abuse community safety lead at Peabody, and she'll be presenting on this topic. And then we're also joined by Abby Blake, who is a survivor of domestic abuse and a real advocate as well for raising awareness on domestic abuse in the community. And then we'll have 15 minutes of Q&A at the very end. So please feel free to ask questions in the Q&A throughout the session today. Just a couple of housekeeping things. We're recording this session. Ask questions at any time. And now I'll hand over to my colleague, Natalie, to kickstart the session.
Thanks, Yvonne. So as Yvonne said, this webinar is part of a series of events that Peabody have been delivering this week as part of International Women's Day. And International Women's Day was started in 1911 and is a global day that celebrates women's achievements and also is an opportunity to make a call to action to accelerate gender parity. This year's hashtag, this year's theme is Choose to Challenge. And the International Women's Day say, a challenged world is an alert world. Individually, we're all responsible for our own thoughts and actions, all day, every day. We can all choose to challenge and call out gender bias and inequality. And that really resonated with me when thinking about domestic abuse, because I genuinely believe we all have a role to play in challenging and ending domestic abuse. And that's not necessarily physically inserting ourselves in the middle of an altercation that we might see in the street, but it is about challenging sexist and misogynistic language. It is about reaching out to support people. It's about making ourselves aware of the support that's available so that when we do come across domestic abuse, we have the tools to challenge and the tools to help people. But I'm going to come back to that kind of call to action later on when I want us to all really think about what we can do, not just professionally, but personally, to challenge domestic abuse. So domestic abuse in the UK, it is estimated that 1 in 4 women and 1 in 6 men will experience domestic abuse in their lifetime. Domestic abuse can happen to anybody. It cuts across any label we want to put on somebody. But it does disproportionately affect women and girls. So that's not just in terms of volume and the number of people that experience domestic abuse, but also in terms of the impact and outcomes that women will experience as a result. And the COVID-19 pandemic has brought unprecedented demand on specialist domestic abuse services. Refuge, who run the National 24-hour helpline, have reported a 70% increase in the calls to that helpline since the start of the pandemic. And many other community-based services, I'm sure I could ask 100 services if they've seen an increase, and 100 of them would say yes. How they've responded will vary. obviously, whilst in lockdown, not able to have so much face-to-face contact, but the demand on helplines and chat functions, for example, on those community websites will have gone up. But internationally, that increase has also been seen. So just a few figures here, and just to say that every bit of data that's quoted here, the reference and source for anyone that wants to do further reading will be available with the slides. So here we can see that Singapore experienced a 33% increase in the volume of domestic abuse reports. Cyprus and France not far behind with 30%, and Argentina there at 25%. But it's not just those countries. There have been reports in the US, Germany, many other countries, particularly where there have been lockdown restrictions enforced, have seen increases in the volume of domestic abuse reports. And indeed in the Hubei province, where the pandemic began, they saw a 244% increase in reports. So how did the world respond? Many services have adapted in light of the limited face-to-face contact available. So here we can see countries have worked with mobile phone network providers to make sure that calls to helplines were free. Instant messaging with geolocation and online chat functions introduced in Spain. Argentina used pharmacies to offer safe spaces, and France had similar pop-up services in supermarkets. You know, places that are still open. Supermarkets and pharmacies have been open throughout the pandemic and in all these countries, and they're places where we all have a legitimate reason to be and to go. So having those sorts of services available when they might be the only places that someone experiencing domestic abuse can go to is great. Colombia introduced virtual access to psychological services and legal advice. And this Polish example, which is just amazing, basically a Polish teenager, saw in the media the increase of domestic abuse throughout that first lockdown and created a fake cosmetics website that enables people to access help and support. So depending on what products they're putting in their shopping basket, for example, will link them in with support. And as they navigate their way through that website, their baskets, if they if they shop in inverted commas and enter their address for delivery, they're basically asking the police to attend. And it's just such a great example of innovation and creativity. It's just amazing. And like I said, this is just a teenager that thought of this idea and subsequently got support from services and NGOs to fund and continue the development of that website. But at home in the UK, tragically, in the first 3 weeks of lockdown, we saw the highest number of killings of women in any 21-day period for a decade. And it's just incredibly sad that that's happened and that these women have lost their lives. Women's Aid reported that 61% of victims were also experiencing more abuse in that pandemic. And we've certainly heard of perpetrators using this as an opportunity to get creative with their perpetrating. So how they isolate and further restrict movement and use children, for example, as tools to cause harm. So how did we respond? There have been a couple of initiatives this year in particular. So in January, the Ask for Annie project was launched, and this is a code word scheme where people can access help via participating pharmacies by asking for Annie at the counter. And Annie stands for Action Needed Immediately. So when asking for Annie, those pharmacists or the pharmaceutical staff know that that individual needs help. The Safe Spaces initiative, quite similar, launched by the UK Says No More campaign, but again involves the use of pharmacies in providing not just space but resources for people experiencing domestic abuse. So, for example, an individual going into a pharmacy, if they say they need help, can have access to the consulting room, access to the internet, access to a telephone, access to local domestic abuse services, all things that whilst being in lockdown, they might not be able to access at home. Many other community-based domestic abuse services are also offering telephone and online support. The use of chat functions, for example, has grown. Just different ways of using technology to support people. And finally, MARACs and other multi-agency forums are operating virtually. And the way they've adapted so quickly in light of, really quite extreme circumstances has been great to see. So nothing has stopped, nothing has ground to a halt. These services, this provision, the partnership working, it's still there. So how did it impact Peabody? So at Peabody, what we saw throughout 2020, apart from a couple of months, February and October, we saw an increase in the volume of calls that we were receiving from tenants and residents who were either asking about domestic abuse, or if not using that language, were asking us for help because they were experiencing some cause of harm. And January this year, we saw quite a huge increase on January 2020 and January 2019. So internally, how we responded to that increase in demand and how we responded to the pandemic was varied. So every tenant, particularly at the start, that first lockdown, something that none of us had ever experienced before, completely novel to everybody. But we made sure we called every tenant every week where we had an open domestic abuse case. And that wasn't just a welfare check, it was also an opportunity to make sure that the action plan that we had in place was still achievable, that the services we made referrals to were still operating and open, that sort of thing, just to make sure that our action plans could be completed and that people were safe and that people were aware that yes, we were in lockdown, but not only were Peabody still there, but domestic abuse services were still there too. We also updated our internal comms and our website so that information was available. We created a short video for contractors that we shared via WhatsApp. So our contractors, even during lockdowns, are still going into people's homes to do emergency work, gas checks, fire checks, that sort of thing, still having face-to-face contact with people, probably not necessarily then thinking about domestic abuse, but we wanted to make sure that where we were having face-to-face contact, that we were using that opportunity, we were raising awareness and we were letting our contractors know if they were concerned, either they've seen something overtly or they're just picking up on signals that there was a response there, that there was a referral route for them to raise those concerns. We also introduced last year a policy for staff who were experiencing domestic abuse. And this was really important because much of what we do as a housing provider is looking outwards. We're looking at how we support tenants and residents. But actually, it's crucial for us to support our own workforce. Said at the beginning, home is not necessarily the safe space it should be. And when Peabody's 3,000 plus staff started working from home, we have no idea if our colleagues or peers are experiencing domestic abuse and if work is safe, if home is safe for them. So our policy set out what our commitment to staff looked like and what they could expect from us. And that included paid time off to do anything they needed to do. It's not defined, but special leave if somebody is experiencing domestic abuse, to make appointments, to, whether that's medical or health appointment or something to do with children, or maybe a case is progressing through the criminal justice system, you know, whatever it might be that someone needs time off to go and manage, that time is now available to them. And that policy has been accessed and that time off has been used. So that it just shows it was needed. And we also introduced a network of trained domestic abuse champions. So volunteers within our organisation who are there to support colleagues in an informal way. So signposting, listening, you know, responding in an appropriate way, the sort of conversations that if offices were open, we'd be having over a cup of tea. Those sorts of, you know, that environment isn't there anymore, but our champions are still available. They're heavily publicised and contactable. And again, it's that informal support when somebody is either just wanting to sound out what options are available to them, or know what the Peabody response might be if they go and talk to a manager, etc., or what specialist services might be useful to talk to. And domestic abuse and BAME women. So we know that domestic abuse amongst BAME women is actually higher than their white counterparts. And in fact, one of the highest rates of abuse experienced is those of people of mixed ethnicity. Safe Lives found that BAME clients suffered abuse 1.5 times longer than their white British or Irish counterparts. And IMCAN just last year found that 92% of migrant women reported that their perpetrator used immigration status against them. So we already know there's a disadvantage there. There's an additional vulnerability that the pandemic could exploit. And unfortunately, the pandemic seems to have exploited that additional vulnerability. So some research by the Fawcett Society, and again, all these links will be sent round with the slides, found that 43% of BAME women were worried about debt as a result of the pandemic, but compared to just 37% of white women. Almost a quarter of BAME mothers reported that they were struggling to feed their children, compared to 19% of white women. So there's a disparity there. And I think it's just something that we need to be aware of when we're working with people and we're trying to support people, that it's not ever going to be a one-size-fits-all sort of response. So finally, moving on, just before I hand over to Abby, what have we learned during this pandemic? I think one of the key things we've learned, particularly if you're trying to homeschool your children, is that not everyone is digitally connected. So not everyone has a device. If you have a device, you don't necessarily have access to free Wi-Fi or any Wi-Fi. And we need to be aware of that because we're responding to people. And I certainly have the, you know, head on. Well, of course, everyone's got a mobile phone. Not everyone has a mobile phone. We need to continue to innovate and be creative. Some of the international responses that I've mentioned were fantastic. Some of our UK-based interventions, equally fantastic. And I spoke to somebody just yesterday who might be here, I'm not 100% sure, but they had introduced, because of the pandemic, a virtual refuge that had enabled their service to support 20% more women than previously. That idea probably wouldn't have come about without the pandemic. It was an amazing idea that's worked really well in their area. So that innovation is fantastic, and I think we need to continue. We know that COVID-19
typing. I can type on that.
Okay. Won't be the last pandemic we face. I think we're a lot better prepared now for when the next one comes. We've learned that we need to challenge and be aware of domestic abuse, both professionally and personally. We're all human at the end of the day. We don't stop being human outside the hours of 9 to 5, so we can all respond in a human way. And finally, DHRs tell us that friends and family and neighbours quite often know about domestic abuse. There's a Home Office report that has the numbers, but what was found fundamentally was that either the victim had asked the person not to do anything with that information, or the person wanted to do something but just didn't know how to help. They didn't want to make things worse. They didn't know what to do for the best. Okay, so I'm now going to hand over to Abby, who is a survivor of abuse and was supported by, her own network. And she's going to share her story with us, and then we'll move on to Q&A. So thank you for listening. Abby, over to you.
Hi, thank you for having me, Peabody. So my name's Abby and I'm a survivor of domestic abuse. I'm also a campaigner and lobbyist. I make changes and amendments within the criminal justice system and the legislations, future legislations. I'm also an ambassador of My Cheshire Without Abuse and a speaker for Women's Aid. And so, yeah, I'm here.
Oh, you've muted yourself. See, technology.
Okay, so I'm here today just to speak to you about, as a society, how we can all work together to help support victims of abuse, and also just touch a little bit on what happened to me and how the community really helped support me through, my events of being abused. So basically, like I said, as a society, we do need to work together, especially in this environment right now where COVID has created a real pressure cooker for victims. I think we need to be increasing awareness and knowledge within our households, communities, the workplaces, and we need to promote a culture of equality and respect so that everyone who's listening or taking on board what's happening about abuse, will help out at some point, take some responsibility, and be there to support that person. So as Natalie's already said, within the four walls of someone's home, you would assume that there is safety, exactly the same as within the workplace. Unfortunately, that's not the case. Behind these closed doors of a residence and or the workplace environment, there's all sorts of abuse going on. So that could be psychological, financial, physical, sexual harassment, stalking, rape, trafficking. And, like I've said, it's absolutely crucial that we as human beings should be there to support a victim if we recognise it, no matter what. And that doesn't mean that you have to necessarily get involved directly. You don't have to be right in front of that person. You can let them know that you're there, or you could at least call the police or report them to some authority, particularly if children are involved. We just need to know that there is danger out there and these people need to be protected. And I'm sure that you're aware, but if you're not, abuse doesn't discriminate. So it's prevalent within all ages, all ethnicities, socioeconomic, various socioeconomic, in fact, all socioeconomic backgrounds, genders, religions. And I can't deny, again, as Natalie has said, that men and boys are male victims of abuse. However, it is, as she's also said, disproportionately female gender-based. So I'm just speaking out today to ensure that domestic abuse, once this talk is finished with, remains on everybody's agenda and is on people's radars. So if we use my story as an example, 8 years ago, I met someone that I thought was the most wonderful partner to exist. And when I first met him, he was charming, he was kind, and he depicted this picture of himself that was actually just a mask. And during that time, being blown away by his charm and by his future desires and his humour, I hadn't realised that he had several convictions behind himself, that he was hundreds of thousands of pounds in debt. He had gambling, alcohol, abuse addictions, alcohol addictions, and all of this was never disclosed to me upon my first date meeting him. Unfortunately, over the years, I became groomed and conditioned, and after sort of 4 years, I just, it was almost as though I had Stockholm syndrome. So it was the normal for me, him minimizing, abusing me, whether it be physically or emotionally, and just consistently making excuses for it. And by 4 years, basically, my mind had been stripped of all senses of reality and normality. And I felt trapped, and I was afraid of our safety. And while some people could just say, well, it's very easy, you know, you just leave, it's not that easy. You can't just leave, especially when there's 2 children there. And, you know, there's the fear of, if you do leave, as I was told, that I'd be 10 feet under my back garden. And each time the boys and him would play football over me, he would tell them that mummy had walked away and left them. He'd also used to threaten me that if he couldn't have the children, neither would I, and he's already set fire to the house, but he'd set fire to us. So there was a real fear factor in leaving. It's just not black and white that someone can do that. On a positive side of things, though, I did have my neighbours on either side of my house and opposite who were aware of this, despite the fact I would try and hide it for shame. And the police were aware. They were continuously asking me to push for charges and press charges, which I didn't do. My family and my friends were aware, and they never ever gave up on me. So some people might walk away and turn away and think, well, you know, it obviously can't be that bad, otherwise she'd leave, or he can't be that bad, I think she's probably just exaggerating a little bit. Everybody around me, including doctors and the community, stood by me. And unfortunately, despite the warnings and despite their advice, because my mind had just sort of been reduced to a pulp of not seeing the dangers that I got myself into with the children. He one night near fatally attacked me, and he'd come home from drinking very late one night, and because I challenged him on it, it ended up in a huge attack on me, whereby he broke my neck. I had a bleeding spinal cord. I had 5 broken ribs. One of the ribs had popped into my lung, so I had a collapsed lung and a hole in my lung. I had a bleed on my spinal cord, and I had to endure a 5-hour operation in intensive care to salvage my neck and spine. Despite all of this, obviously no one anticipates that you'll either end up in intensive care or in a morgue or thrashing it out in criminal court. And despite all the warnings, I chose to believe that, you know, this would never happen to me, and it did. But had it not been for the community, and had it not been for the support of everybody around me, the fact that they'd recognised it and they didn't turn a blind eye was eventually what got me through everything as to where I am today. Obviously myself, and then domestic abuse support services, but just people who didn't turn their back on me. And, you know, they were faultless in terms of how they would still send messages, or they communicate, or they would just ask if I was okay, or they'd knock on the back door. So that meant a lot to me. Well, it meant a great amount to me, actually. And so just briefly, just to sort of sum up, you know, going back to the choose to challenge, if you are, or you believe, or you're aware that somebody is being subjected to domestic abuse, or that they're suffering some form, or their children are, you know, please be there for them. You know, make sure that you know that they are there for them, or that there's a place to go to, because, or report it, because you could be saving a life. And that's it. Thank you.
Thank you, Abby. Thank you so much for sharing your journey with us, and that advice around how people can support and help. And I think it's really crucial. I mean, the pandemic has just highlighted what friends and neighbours and family members can do, but it's always existed. We shouldn't turn a blind eye. If we know something is happening, there's a number of things we can do. And like I said at the beginning, it's not necessarily about kind of getting fisticuffs in the middle of a fight. But there's like I said, a lot of things we can do. So if you're concerned about somebody, reach out to them when it's safe, when they're on their own. If you have that opportunity, just let them know you're there. You don't have to do anything. You know, it's not about getting them to take action. It's just about that first point, just listening and letting somebody know you're there. you know, you're a shoulder to cry on, you're an ear that can listen whenever they want. Secondary to that is if somebody does disclose to you, or maybe, you know, maybe not even explicitly saying they're experiencing domestic abuse, but what they're telling you is, gosh, okay, that sounds like domestic abuse. Try not to jump into kind of action planning mode. Try not to take charge of the situation. Any action that individual takes has to be led by them. So be supportive of the actions they want to take, whether that's, you know, linking in with a domestic abuse service, or keeping a bag of, you know, like an escape bag, documents that are important, passports, you know, driving licenses, that sort of thing, but be led by that individual. In terms of like our kind of professional hat, just find out, have you got a policy? Have you got a domestic abuse policy? And if so, what does it say? If you haven't got a domestic abuse policy, challenge it, ask, why don't we have one? If you do, again, find out what options are available to people. So I mentioned at the beginning, well, a little bit earlier, about our paid time off. If you have information, knowledge is power, basically. If you have all the information that you can share with somebody, then that's great. Also look to join networks at work, at your place of work. I've mentioned the Domestic Abuse Champions Network. I've mentioned the Gender Network. Find out what networks there are, join them, and start vocalizing all of this stuff. And finally, I would say, before I move on to the Q&A, we can all challenge everyday sexism and everyday misogyny, that kind of casual, kind of, oh, banter, it's, you know, throwaway comments. That language is harmful. Language is powerful. So if we're coming across that kind of everyday sexism in our workplace or our personal life, you know, challenge it. Let's call it out where we see it. Okay, I'm going to stop talking and move on to our Q&As.
No, definitely. On your last point, another plug for the Gender Network, there's such an intrinsic link between gender inequality and domestic abuse, which is a whole other webinar, which probably we'll do now. But as Natalie says, challenging those everyday sexist interactions, or learning more as well. And that's part of the reason why we put this program on for International Women's Day, is to help raise awareness of everyday realities of gender inequality. And on, you know, the more kind of extreme end of that is domestic abuse, where women disproportionately suffer because of that. Just a quick comment for you, Abby. One of our participants has said that she's he or she is very sorry that you had to go through that. And I definitely felt the same way listening to your story as well. So thank you so much for sharing. Natalie, this one might be for you. You talked earlier about women who are from Black and ethnic minority households disproportionately having higher incidents of domestic abuse. Now, the question is there a cultural element to this?
There could be, but I think it's hard to draw conclusions because there's so many other factors. So, for example, when we look at the fact that BAME women experience domestic abuse 1.5 times longer, why might that be? Is it something as simple, and I say simple, as a language barrier? And I say simple because we as professionals, we as services should be able to produce our tools and resources in another language. That should be simple. We should be able to quite easily tap into things like language line and interpreters. If people cannot access services, they will experience domestic abuse for longer. If people are within a community where domestic abuse is more accepted, they are unlikely to challenge it and again continue to experience that domestic abuse for longer. So there's a lot of factors at play, and I honestly wouldn't feel confident about drawing a conclusion on that. But yeah, I think it's probable.
Yeah, I think there's that link between, if there's a language barrier or any kind of barrier for you to access information, whether it's disability as well, or if there's, in some communities potentially, if you don't trust authorities or institutions, again, it may play part.
And again, if the people who you would usually go to for your sources of support, like family, are actually the people who are posing the risk, that's another barrier to kind of being able to access help or even disclose in the first place. But actually find, sorry, I was just about to go off on a completely other tangent then, but I won't, because I know there are other questions.
Yeah, it might be useful perhaps if you know any useful resources to share after this session on that topic as well. Anything you may have come across in your research, we might be able to share that with participants as well.
Yeah, absolutely. I mean, some of the raw data, like the stats around people of mixed ethnicity experiencing the most abuse is ONS data, but the findings from frontline and secondary services like Safe Lives and Women's Aid gives much more insight into, well, that's the data, but why might that data exist? So yeah, absolutely.
And again, 2 more comments for you, Abby. One from Eva to thank you for sharing your story, and so glad that you're here today, and I echo that as well. And another one from Maria saying thank you for being so brave and sharing your story.
Oh, thank you.
I think it's so important to have you here, because as we all know, data says one thing, but to hear someone's lived experience is another thing altogether. This is a question in regards to housing supply, Natalie. Given that housing is so limited, what more do you think can be done to provide safe home for survivors? What more could be done by government? That's a big question.
Money, lots of money.
Maybe not so big.
I think one of the things is this narrative we have of why doesn't she just leave? The fact that we expect historically victims of domestic abuse to pack up their bags, take their kids and trot off to a refuge 200 miles away. Refuge will be the appropriate answer in some cases, but in some cases, the person who's experiencing that abuse will not want to be re-traumatized. They want to stay in their own home. So let's make those homes as safe as we possibly can physically, sanctuary works and other improvements to the physical home. But also let's hold perpetrators to account. Let's flip that why doesn't she leave narrative on its head and ask why doesn't he just stop. I think we need more housing stock. People who do go into a refuge can find they're basically stuck. They're bed blocking, just like trying to come out of hospital, because there's nowhere to go. So more properties with support. So rather than just one day you're in a refuge and you've got an advocate and you've got people in-house and the next day you're on your own, you've moved out, support around that to develop networks and integrate into a community that you might not have lived in before.
Yeah.
And I saw, in the budget, this talk of respite rooms. I have no idea what a respite room is. And I then saw on the news, a couple of CEOs from domestic abuse services also saying, yeah, it sounds great, but we have no idea what a respite room is. It might be that there was a great idea in the pipeline that the sector just doesn't know about. But there's money there for these things called respite rooms, if anyone knows what they are.
On your point around flipping the narrative, one thing that I feel really bothered by this week is the likely murder of Sarah, is it Sarah Everard?
Yeah.
And the response that I've seen in the media or by some people saying, we need to light our streets better, we need to light the common up more. Well, no, to me, that's not the answer. We don't need more lights. We need more gender equality for a start, and for women to feel safe on the streets, regardless of whether it's light or dark. And again, another webinar in that. But as a follow-up to this question for you, Abby, someone's asked, do you feel safe now?
It's a difficult question, actually, because there's part of me that would like to say yes, 100%, but unfortunately he was released earlier than anticipated. So I don't think I'll ever feel safe, because because I have a child with him. So there's always that could come into play at some point. And so in terms of contact, at the moment he's been denied contact, but now that he's been released, the fact that he could be applying for contact, and therefore the ball starts rolling again in terms of manipulating me and what he could, or whether he receives contact. So do I feel safe? At the moment, yes, but I just don't know what tomorrow brings in terms of child contact, and then that becomes then a whole other story. I mean, I have an indefinite restraining order, but at the end of the day, that's just a piece of paper. Just going back to what you were saying about Sarah, and lighting up the common and lights, etc. And I don't know, again, if you've when people say that, well, your window's open so you deserve to have been burgled, or she was wearing a short skirt. There was a girl in Australia that went backpacking that they said, because she went on Tinder and she was wearing a short skirt, she deserved to be mutilated, butchered and put in a suitcase. It's all these stigmas and all these myths that really that raising awareness and talking about this need to stop. And so I think by doing your talk today, and obviously a lot of the talks that you do, hopefully these messages will get out there. There's just no excuses for murdering, mutilating or abusing anybody. I just wanted to say that.
No, thanks, Abby. We've got just a little bit over 10 minutes left and quite a few questions. I don't think we're able to cover all of them, but there is another one here for you, Abby, which, sorry, where has it gone? With police interaction for people who've experienced domestic abuse, what do you think could be done differently to better support them from your experience?
From my experience, well, I was fortunate enough that Cheshire have rolled out this pilot scheme. So one of the DCIs who took on my case, she decided to spearhead a pilot scheme, which should be done across the whole of the UK, to be fair. And what that entails is particular officers are trained, and that they will be designated only and wholly responsible for any victims of abuse in our area. Therefore they create that bond or that trust, or they get to understand the case a lot more. So as a victim, even if it's a child, if you're lying, they can begin to tell the signs. They go on psychology courses, and so this has been a really, really successful scheme over in Cheshire, and I think that that's what the UK, certainly England, needs to do, is to start putting designated officers and teams together to go out and support, versus different ones all the time, and then they don't even know, they wouldn't know a victim's name or a perpetrator's name, and they just come in and come out. So that would be my advice, if we could do anything with the police, is to put out those response teams.
Great. And another one from my colleague IJ for you. What's the one thing that you would tell someone who's in an abusive relationship now?
Get out. It will end in three ways. It will end up in court, or the victim will end up in a morgue, or they will end up in hospital. So no matter what, even if I couldn't see or hear, at least if they pass the advice on, it's just get out and leave.
Yeah, definitely. A question for you, also related to this, Natalie, is what are we doing at Peabody to help improve access to our services, given the accessibility to different groups we know is really important? I'm paraphrasing there.
Yeah, and actually, Yvonne, I mean, you might be able to answer better where we are with this, because we are looking at the moment to overhaul our website in its entirety, but also the information that we have on there about domestic abuse. Because at the moment, everything we have is not only written, but it's written in English. So if English isn't your first language, or you're not literate, or you're partially sighted, you're not readily going to be able to access Peabody's information on domestic abuse. So we're looking at implementing a model there that translates on demand almost.
Yeah,
and
so
Yvonne,
that was actually,
Yeah.
No, so that's something from my day job, actually, in my communications role. And it was born from a conversation with Natalie, actually, where we were thinking about how to translate certain pages. And when I explained this to my colleague who manages the website, she said to me, no, you don't manually translate pages anymore. AI technology does that for you. So what we've actually done is actually procured a plugin tool for the website, our corporate website. You can actually have a look at the Gatwick Airport website if you're interested to see how it works, because ours is implemented this month. And you can translate any web page to over 200 languages, and it would also do a read aloud, which I've tested and is very accurate. So it puts the power back into the user's hands for them to choose whether or not they want to enlarge a screen or how it is they want to access the information. So it's really changing that dynamic between the provider of services and information and the user. So it's not us necessarily changing things for them; it's them telling us how they want to access that. And that's a small change, but we're hoping will make a difference for people to find out more about what they can access. Lots of comments here. I'll just read a couple of them out. One from Paul around coercive control is being highlighted a lot in the press. And what advice can help the victim is so hard to be believed, especially when the perpetrator presents as charming. I don't know if you have any comments on that, Abby.
Well, I'm finding myself, just because as a volunteer working within all the refuges locally, internationally, and going out and speaking out on behalf of perpetrators, male and female, it's very, very difficult because you have to prove it. You know, even with my case, it had to be Loctite evidence, despite the fact I was left in the condition that I was. So all I can say is the coercive behaviour, if you're living with someone, you by law are allowed to record them, whether they know or not. So within your own house, you're allowed to record secretly. And that's not to say the stalking and harassment side of things, but just to prove, you know, that there is concrete evidence of this going on. Whether it be, you know, they're doing things with your technology, or whether it be psychological, to keep every single message that's ever sent to you, just to log and compile and collate every single piece of evidence that could prove that someone's being coercive with you. Because it gets to a point that you actually then, you don't believe it. They're so good with the mind, you know, you don't even believe, oh, hang on, I'm sure I put that there, or I didn't put that there, or that's moved, or my money. So, you know, if you think that it's happening, or you think it's happening to you, then just to, just gather everything together before you go and make or want to press charges.
Yeah, and you know, all the comments here today, and like, certainly how I feel, it's so terrifying to hear stories like yours, and it really makes me think that it could happen to anyone, including me. And I just can't imagine being in that position, having to make that choice, especially in situations where financially, if you're being controlled, and if you're worried about the safety of your children or your pets. I've also heard of horrendous stories of pets being, you know, having awful things happen to them. And yeah, just being in that position, you know, it's so brave of you, Abby, to share with us. And I'll just quickly plug for you, Abby's done an excellent interview on Good Morning Britain that you can find on YouTube that I watched leading up to this as well, which I really recommend. Abby speaks really powerfully about her experiences there as well. And just another comment here around support groups. I don't know, are there any support groups that we offer to victims of domestic abuse, Natalie, or do we refer on?
We refer on. So our neighbourhood managers, our housing officers and other staff will always link in with specialist domestic abuse services. So usually that will be, you know, a borough-based, community-based DA service, but it might also be a national service where there are where there's the need. So if somebody's working with an LGBT plus client, for example, they might link in with Gallup. If they're working with BAME women, depending on the background, they'll link in with other services, or, you know, services for older people. So it's very much about partnership working rather than Peabody delivering frontline support services themselves.
Yeah, absolutely. Just a comment here again that I'll lead into the next question. Someone saying here that people often react by saying women should be more careful and stay indoors, which is not at all the response that we need. And I think for me, that's a tricky one, because as a woman living, you know, I moved here to London 5 years ago on my own, and you know, I commute home by myself often pre-pandemic, and I'm so safety conscious at nighttime because I know what the stats are and I know that I'm at risk. And so even though I'm obviously a staunch feminist and I believe that the streets should be safe for me, I'm still incredibly careful because I just don't want to be that person. I don't want to, you know, put myself at risk, because whether or not I want it, the risk is still there. That's unfortunately how I have to live and navigate the streets of my life.
Sorry, just to intervene, Yvonne, there are more victims of abuse and homicides within the house than on the streets. It's actually safer on the streets. I think that's just a perception, and obviously it can be, even in my local village, you walk, there is that fear, but actually it's more dangerous to be in the home of a perpetrator.
Yeah.
That's a great point.
Your mind feels a little safer.
Yeah, no, that's a great point. We only have a few minutes left, so I might wrap up with 2 questions together around what we can do moving forward, having covered all of this today. And we have 2 questions here around what can communities do to prevent this from happening further. And also someone else asking, starting at home then with parents, as we've just discussed, what can we do in terms of the young people who we're raising, and what sorts of examples can we set? I think both of you might like to comment on that. Abby, I know you as a mum as well.
Well, within the community, I know I've actively gone out and put posters. I've given great good packs to the doctors, the chiropodist, community centres. I've managed to get them on the back of coffee shop doors, toilets, you know, where women can go discreetly and then they can take a number down. And as a community, again, just to speak out about it, raise awareness. I think as much help, because I didn't realise, one, that I was being abused, so I didn't know it was abuse. So I had no idea that there was Women's Aid or Safe Lives. I had absolutely no idea until I was in hospital, and a Marek team member was looking after me, and she had told me this is what was happening. So again, it's just also GPs, you know, professionals, if they can train GPs more. The services, the police around here, anytime that they now go to a home within Cheshire, I don't know what it's like in London, they carry the My Cheshire Without Abuse cards with them and say, if you need to call, you know, here's a number, and they do it in those credit card size little cards so they can be discreetly put away. Like I said, like Natalie said, within the pharmacies, people can now go into the pharmacies. It's just speaking out, raising awareness. Social media, that's a great thing, you know, that's a great plug.
And I think it does tie into the second part of that question about young people, and what young people learn from us as adults and caregivers and teachers, etc. And I think it really starts that early with, and when I say, you know, we're talking about challenging everyday sexism, to me, boys will be boys is everyday sexism. So boys can be, you know, kids, but aggressive and roughhousing and, you know, doing stuff, and we say, oh, boys will be boys, that's okay. And if a girl does it, oh my God, you know, it's the end, girls don't act like that. So even at really young age, we're already setting these gender stereotypes where it's okay for boys to behave one way and girls have to conform and behave another way. And I'm not saying that's kind of the root of domestic abuse, but it is the part of the root of such a gender bias. Also, even still now, and I know from personal experience, good girls are put in charge of the naughty boys. Good girls in the classroom are made responsible for naughty boys' behaviour. Why? Why are we already conditioning our young girls, like 6, 7, 8 years old, to be responsible for the naughty boys? Like, and again, I do get on a bit of a soapbox with this one, so I won't go on, but challenging that. And I just, one of the things I was going to include today that I didn't because we didn't have time was, you might have seen on Facebook a piece of homework that was set recently, and it was so gender biased. It was about a mum returning to the workplace and how distraught her daughter was that she had to go to after school club. And basically the homework was this little girl had to fill in boxes. The mum, good on her, rewrote that homework from the perspective of, actually, my mum is a functioning member of society and can go to work, and I'm perfectly okay, you know, getting myself a drink and all the rest, and sent it back to the school. That is something we can do. That is something society can do. Just challenge nonsense like that. And now I will get off my soapbox because we're running out of time.
No, I love a bit of soapboxing. Thank you both so much. We're going to wrap up now because we've just hit the time, but I've certainly really enjoyed listening to you both. So thank you again for joining us. And thanks everyone else for dialing in today.
Yes, thank you everybody, and thank you Abby, Yvonne and Nikki.
We'll send around a recording of today and also some further resources. But thanks everyone, bye.
Bye.